Hello my viewers, welcome back to my YouTube channel. And before I begin, my name is Josephine Nyamasio, and in my channel I talk about or I teach about pregnancy and childbirth. So in case you have any question concerning pregnancy and childbirth, feel free to ask and I will be available to you. And in case you have not subscribed, for the ones watching without subscribing, hit that subscriber button and join this amazing family. So today's video is all about hospital birth. It's all about hospital birth. And for some women, the decision to have a hospital birth is made for them because of their physical condition or their obstetric history. For some women, the decision to have a hospital birth is made for them because of their physical condition or their obstetric history. And however, if you do need or want a hospital confinement, if you do need or want a hospital confinement before you decide on a particular hospital, there are many questions that you may want to ask. There are many questions that you want to ask. There are these reasons that these cases that arise concerning such some hospitals that you went to certain hospital, you didn't get the care that you were supposed to get, and this you cannot blame the hospitals. It is you who didn't confirm or you didn't do investigation before booking that hospital. You didn't ask questions that you were supposed to ask before booking that specific hospital for your delivery. And that's where we make mistake. That's where we mothers we make mistake when we are going to deliver. Because why am I saying this? I'm saying this because women have different pregnancy journey. My journey is not like yours or so our journey are always different, and some are easy, some are medium, and some are tough. So you need to look for a hospital that has, in case you have any complication, has all the facilities, and you will be on the safe hands. And that these cases that arise after giving birth will not be there, because you will have made the best choice. And I want to give you these reasons. I want we to go through some a few things, like I use why you use a checklist. Why checklist is important when you want to decide on a particular hospital for delivery. Why a checklist is very, very important when you want to decide which hospital for delivery. And I'm going to break them one by one, so that from here, when for the ones who are pregnant, before you deliver, at least you know where you lie, you know where you belong, and you know what you are needed to do for you to be in a better or in a nice hospital that has everything that you desire. So be very keen as I break them down. Number one, can my partner or friends stay with me all the time, and after the baby is delivered, can my partner and I can my partner or a friend, yeah, you might not be with a partner, but you can be accompanied by for, by a friend, yeah, are they will they be allowed to stay in the hospital with you all the time? You need to ask yourself, uh, to ask when deciding which hospital. You need to ask that very question. And number two, if I need a cesarean section, in case I need a cesarean section, can my partner or friend be with me? Can my partner or friend be allowed to be with me? Because not all hospitals allow everyone. When having such cases, people are restricted, not allowed to the whatever, to the area, just, and if allowed, it is for a short period of time. Yeah, so you need to make good, you need to get good information. If you and your friend, if your partner and your friend will be allowed in the hospital in case of a cesarean section. And number three, may I walk may I walk around during labor? If everything is okay, may I walk around during labor? If everything is okay, are you allowed? Because some hospitals, there is you are not allowed, you are just inside the ward, you're not allowed to move around. So in this case, if you wish to be moving around the hospital for practice before delivery, are you allowed? So in case you want to be allowed, please ask before you decide. Go asking these questions. And number four, may I choose the position in which I can give birth? Are you allowed to to choose the position that you want to give birth in? Because the way I give birth, assume now you're giving birth normally, so you there's this we call squatting, and or sitting on a stool or any other position, or lying. Which one works on you? Which one will you feel comfortable when you are in? Or when you are in this position, then you are you get to push the baby easily. So you need to ask yourself that question. Are you allowed to choose? Because when you go there and get nurses and they tell you to do this position, and this is what we do here, you cannot even deny, you cannot go against them. So these all things you need to work on them before. These things you need to know them before going to ask or deciding which hospital you are going to deliver your baby. And number five, do women have their waters broken as a routine? Do women have their waters broken as a routine? This also you need to ask, you need to know. And number six, what percentage of women do you induce in this hospital? What percentage of women do you induce in this hospital? Why do you have to ask this question? Do you know, you might you can go to a certain hospital, thinking that it's just easy as that, and things change, and the worst happen. So in this case, do they have another option? Do they have another option? And this is what you need to understand. This is what you need to, this needs to get into your mind before deciding any hospital that you deliver in. You need to know what percentage of women do you induce, and that this helps in knowing the experience of that facility. This helps in knowing the percentage, the experience of that facility. And number 7, how many women have continuous electronic fetal monitoring? How many women have continuous electronic fetal monitoring? In case you are not in good condition, is there electronic fetal monitoring that can be there for you? At least you can be monitored how your baby and you are doing before delivery, because this monitoring checks oxygen, checks the heartbeat. Do they have one? And which rate do they does it work? So you need to also know this. And number 8, what percentage of women have an episiotomy or a forceps delivery in this hospital? What percentage of women have an episiotomy or forceps delivery in this hospital? So this, in case you are delivering normal, this forceps and episiotomy helps in case the to push the baby's head. If the baby's head is not coming out, that's when they use this forceps or episiotomy method to deliver the to push the head out. So you need to know if this works in that facility. And number 9, can I arrange to have no drugs for pain relief in this hospital? Can I arrange not to have painkillers in this hospital? Because if you are not willing to have those painkillers, why should you take in the first place? Why should you take in the first place? You should not. So if you feel you are not ready to take them, if you feel you are not ready to take them, inquire first before booking that facility for delivery. Inquire first, so that they will just look into your file and see what you chose. Yes. So if you don't want painkillers, then look for a facility that allows that, to avoid misunderstanding, to avoid arguments, to avoid feeling like you are being pushed to something that you don't want. And number 10, when a cesarean birth is planned, how many women have epidural anesthesia and how many have general anesthesia? You also need to ask this. When let me repeat this. When a cesarean birth is planned, how many women have epidural anesthesia and how many have general anesthesia? And number 11, can I have such as much time as I want to cuddle the baby? Can I have as much time as I can to cuddle the baby? So you need to also know this. If you are allowed to have a baby, if you are in good health, and your baby is in good health, are you allowed, and for how long? This also is very important. You need to know. You need to know before deciding or before choosing your facility. Yeah, the facility that the hospital that you are going to deliver. And number 12, if I have a caesarean, if I have a caesarean section, can I uh, or the father of my baby hold the baby afterwards? If I have a caesarean, can I or the father of my baby hold hold the baby afterwards? Because if you are from caesarean, it depends on how quick you have recovered. This depends on how quick you have recovered, and if you don't have the energy, then the father of your baby is next to you, and can you be allowed to be with the baby? Or they would say because you are not able, then the baby has to be taken to the whatever babies where they are, I don't know, incubator or whatever. Are you allowed to be with the baby, to be with your partner? I mean the father of the baby after caesarean. So this is also important. And number 13, can I use aromatherapy oils during labor for massage? Can I use aromatherapy oils for massage in case you feel a lot of pain? Are you allowed to use a certain oil for massage? Are you allowed to use aromatherapy oils for massage? Are you allowed? Please, this is very important. Maybe you feel much pain, maybe you feel a lot of pain, and you in your mind, you just wish you could have a massage, you could have applied this oil, but is it allowed in that hospital? So before deciding on a particular hospital, this is also very important. And number 14, is there free visiting time? Is there free visiting time? Assume you are there waiting for your visitors to come and see you and the baby, or to come and see the baby and you, and someone is coming from far. When they reach, they are locked outside, or when they arrive at the hospital, they be told you only have 5 minutes, you are late on the way, maybe there was traffic jam. So you need to be clarified concerning what time or for how long, for what duration of hours, yeah, are your visitors allowed, and how many? Because some say they only need one inside. This, all these rules, yeah. And that's why I keep on insisting. That's why I keep on insisting that before you book before you decide on a facility, please go through these 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 factors. Go through these all factors and see where you fit, and see where you fit, because that's very when moving from one hospital to the other to confirm these things, what they offer, then they give you they tell you everything into details, and your work is to just check. Your work is just to ask them what you require if they offer. So if they don't, then go look for another facility. There are many facilities, good facilities. So you are free to go and look for the facility that accommodates you. And number 15, and this is the last one, we are closing here. That is number 15. Is it possible to arrange a 6 hours or 12 hours or 24 hours discharge? Is it possible to arrange a 6 hour or 12 hour or 24 hours discharge? This is if in case you have delivered normal and your baby is in good position, in good condition, that is healthy wise, and you are okay, and there is no complication, then are you allowed to be are you allowed to be discharged within, let's say, 24 hours? The baby and you, are you all allowed to be discharged? You need to also ask this, because may I feel if you have good support, may I feel if you have good support system, excuse me, may I feel if you have a good support system, then why start, and in the hospital, why remain in the hospital? If your baby is okay and you are okay, and at your home you have good support system, you can go home and be taken care of there. You can go home and be taken good care of there. Yeah, so if you wish to go within these specific times, that is 1 day or below, that is 12, 6 or 24 hours, ask these things before you decide to you decide on a particular hospital. Please ask this, ask these things before, ask these things before, and they will help help a lot, and they will reduce these cases of there was no someone didn't attend to you, that they were busy, the beds were full, or I don't know what. These things are prepared, are arranged in time. Don't rush, don't wait for the 11th hour. You've been there going to facilities for 9, going to antenatal clinic for 9 good months, going to antenatal clinic for 9 good months. So it has not just happened in a day. It has not just happened in a day. This you have been pregnant for all these 9 months. Please take your time, go through these things, take your time, go through this checklist, and make proper arrangement of where you are going to deliver, and I promise you, you will never regret. These all cases of my baby, they waited until the baby was tired, I don't know, this was this and this happened, that and that happened. There will be no that case. And if it happens, then that is another case, that will be another case. And we are ending our video here. In case you are watching you are watching and you have not subscribed, please hit that subscriber button and join this amazing family. Don't forget to like, to comment, and to share. Please share as many times as you can, share as many times as you can. And I'm ending here. Bye bye, see you in the next one.